is Tuesday, January 23rd. This is the Public Health and Safety Committee. We do have a quorum with myself, council members Benton, Bradford, Gregg, Huffman, Nash, Sepulveda, and Weiner. And I'll announce anybody else that comes in later. To get us started, one of the things that happened, of course, with our last meeting, we had a lot of conversation about the security grant that we accepted and robot dogs. And so we didn't get to hear from the Office of Homeless Services. And so I'm going to invite Mr. Clendenning to come up and talk about the most recent report. And so I will recognize you now, Mr. Clendenning.
Thank you, Madam Chair. Good afternoon, committee members. Yeah, so we wanted to, we give this update once a month, but we wanted to make it a little more effective. So we've made a couple of changes. I know you received it in an email and you should have a paper copy in front of you. But something simple, we added really easy to see page numbers so we can refer back to that and do that easily. But we also added a highlights kind of summary page because we figured we want you to read the report and, you know, obviously if you have any questions, ask us about it. But we also thought we'd point out some things that are going well, some things to take, of note, and then also any challenges that we might be seeing. So I'll just go over a couple of those. Community Care Fellowship has opened its 6th mobile housing navigation center. It'll be focused on youth aged 18 to 25 and through the partnership with Launchpad. Unfortunately, 2 of the locations, CCF locations, will be closing, but they are looking for other sites that had to do with the building they were in and that sort of thing. And we're working with them on that. One big highlight, increasing housing options for the most vulnerable national neighbors experiencing chronic homelessness by increasing from 10 per month that were housed to an average of 34 per month currently. So that's a big step up too. Obviously the encampment surges are, noteworthy. And of the 147 that have been assisted through the encampment surge, 67 are currently in interim housing, 48 have moved into permanent housing, 17 have unfortunately returned to homelessness, 6 incarcerated, 4 deceased, 2 have entered a treatment facility, and 3 have moved into a hotel or other location. So we're monitoring that very closely. One of the challenges that we do see is that we're seeking opportunities to decrease barriers in our mobile housing and navigation centers to make sure that that everybody is like approaching this with a housing first approach, which is no barriers. And so we are having meetings with CCF and the Salvation Army. The Salvation Army meeting actually was last week, but it got canceled because they were working the shelter and some of the things that came up. So we do have those meetings coming up. Also, we wanted to highlight some things that are not on there, which are some community events that we're working on. And one is the Homelessness Planning Council. We're having like a 3/4 of a day event for them. That's on 2/9. You're welcome to come and we can give you more details on that. But it's a deep dive for them so that they understand what their role is, everything that's going on, all the different components to our efforts, and so that they can be the most effective in their role. We also are having an event on 3/7 that is highlighting the housing first efforts that are going on, and Sam Sabaris is going to be a speaker there. He is the founder of the Housing First concept. So that's a big win. And that's a half-day symposium. And again, we'd love for any of you to come and spend time with us there, and we can get that information out to you as well. One thing we're also going to be adding, on page 5, you see the interim gap housing fund spending and what's remaining. And we're going to, I'm going to add the contract end dates for each of these items so you know exactly how much money is left and how much time is left. Another thing of note is on page 7, the gap financing for permanent supportive housing. We just wanted to highlight the second column, total affordable housing units. These are units that can be accessed by voucher And, you know, we do get excited about the 73 in the column to the left, but we just want to make sure that, you know, there is some attention brought to the 681 units that have been produced through this effort. And in the blue, you'll see the 165 and the 4 are already open and taking clients. Also wanted to talk a little bit about the housing support services. We continue to have those meetings twice a month with the supportive services providers. And, you know, I think one of the things that you'll see on page 10 and 11 is how many people have been served by the supportive service providers. And what we do is we're able to, you know, through this data, identify what's working, what's not working. And you can see with Colby's Army, there's only been 2 referrals, and those are coming from the 2 intensive case management providers, which is MinMe and Step Up. So we're retooling that process, taking it on with our staff, and we're going to make sure that number comes up to where it should be. Those are the big highlights that we wanted to talk about a little bit. And you'll see the total spending breakdown on the very last page, or the next to the last page, excuse me. And, you know, we'll keep updating that. I also wanted to, I'm sorry, go ahead.
Oh, no, please continue.
I just wanted to mention that we also have an item on the agenda tonight, and that is for the renewal of the HUD HMIS grant that provides the funding for, we are the OHS is the HMIS lead for the Nashville COC, and these are funds that support that role. The HMIS vendor, which is WellSky, licenses for the community and that sort of thing. So that will be on the agenda tonight.
Thank you. Before I open it up to questions, one question that I had in reading and hearing from you is around the Mobile Housing Navigation Center, the sites that are going to be closing. Any insight on sites, the kind of sites that they'd be looking for to potentially, you know, reopen in other places that, you know, we can kind of keep in mind in our communities?
They've partnered with churches in the past, and that's always a good fit for them. So if you know of any churches that have space they'd be willing to share, that'd be great.
Okay. And we can reach out to you?
Yes, ma'am.
Okay, great. All right. I saw Councilmember Huffman's hands. Let me recognize you, Councilmember Huffman.
Thank you very much, Chair. Thanks as always for the report. It's been really good to see this level of data. I had 2 things. One is really just a compliment to overall the Office of Homeless Services. I have a pretty large encampment in my district known as the Hermitage Camp, and April and Lakeisha and all of that team have been extraordinary to work with on every level. We've got a long way to go, no doubt about that, in regards to our fight combating homelessness, but we've got the right people in place. So I just want to note that for everybody on the committee, my feelings on that. Also, one request, if possible, moving forward. So I sit on the planning council, as you know. We always get this that Hannah always prints out. I always like it just from the strict point of it shows trend lines from month to month over usually about a calendar year or 2. Could we get a copy of this as well as that's produced?
Actually, Hannah and I were having a conversation about that exact thing this morning. So we're going to add her data into this report as well.
Awesome. Okay. All right. Thank you.
Sure. You're welcome.
About any other questions for Mr. Clendenning? Let me recognize Councilwoman Sepulveda.
Great. Thank you so much for the report. I have a couple of questions. So this is ARP funding, and I think the deadline to obligate fund is the end of this year, and you all still have a little over 31 million left to spend. I did see that you all just closed the low barrier housing collective competitive grants in October, and those will be awarded soon probably. But what is the timeline for the rest of the funds?
Very good question. The capacity building grants that you just mentioned, we are in the process of drafting those grant agreements, and those will be going back out for signatures and that sort of thing in the next month or so. So those will be in place. Also, the dates for the end contract dates vary. So for instance, the interim gap housing 10/4 and 10/31/24 are the dates, the end contract dates for those. But like the supportive housing, is it like 5/31/26? So it varies, according to the role in this. So there is still some time, and we kind of feel like with the capacity and the timing that we're about where we should be. Of course, some of the money, the 25 million, was for development gap financing through MDHA. So
and they're behind on that.
Recognizing April Calvin, Director of the Office of Homeless Services.
Thank you for that. So there's been 3 rounds that actually went out as far as the affordable gap loan. And I think there's going to be nearly 10 million that will be undersubscribed. And actually in the literature or the legislation, it will roll into the Barnes Fund at that point. Anything that was underspent or underutilized will roll into the Barnes Fund. I've worked closely with Director Angie Hubbard on ensuring that that fund or that portion of the fund would still be dedicated for permanent supportive housing and or people experiencing homelessness as well.
Got it. So just from the 31 million left, you expect just 10 to be not used specifically for this, but roll into the barn?
Yes.
Got it. Thank you.
Thank you, Councilmember Sepulveda. Any other questions? Okay, thank you, Mr. Clendenning. Appreciate you and April being here today. And one other thing, kind of talking about compliments, if you paid attention to social media at all, because we had so much time on our hands whenever we were snowed in, the Office of Homeless Services continued to work. All the partner organizations continue to work to go out on cold patrols, find people experiencing homelessness, encourage them to come to shelter, get them to shelter. And so they spent a lot of time last week working on behalf of our unhoused community. And so thank you all for the hard work and the extra effort and time that you put into making sure people had a safe place to go. So thank you. All right. The last meeting, we also had a question from Councilmember Porterfield for Metro Health about the increase in syphilis in Davidson County. And so Cabrera Leach is here from the health department, but they're still kind of out, aggregating data. And so February 6th is when we'll hear some information related to syphilis in Nashville. So I wanted to put a pin in that. Also, as far as some updates, one thing I wanted to mention is, some of the license plate reader meetings, were rescheduled. These are the meetings with the community board. And so they were published on the Nashville.gov calendar on behalf of the Metro Council, so we could all attend, not worry about sunshine, all that stuff, to be able to participate. So those were rescheduled from last week into this week. So I would encourage you to check the council calendar related to those dates. They are open to the public. You can disseminate that information to anybody in your community who may be interested in attending. We did not have anyone sign up for public comment today, so that is, of course, still an option for community members that want to come and speak to the community about something that is on the agenda, but just wanted to put that out there. And I'm looking to see if we had any other committee members come in, and we did not. And actually, Councilmember Weiner, not to put you on the spot, but I'm going to put you on the spot. One thing I meant to write down was the date for the PET meeting, and so let me recognize you if you're able to share the date and location with everybody.
That's easy. Thank you for putting me on the spot. I was going to ask anyway, so this is good. January 31st will be the PET advisory meeting. It will be in the jury assembly room downstairs.
Okay, very good. Thank you, Councilmember Weiner. Appreciate it.
Thank you.
All right, with that, we will go ahead and move on to our agenda. I'll go ahead and start with the first item. I do have quite a few things on consent, but just to get the first item out of the way, which is RS 2024-158 by Porterfield and Evans, approves Amendment 2 to a sole source contract between the Metropolitan Government and Fusus Incorporated to increase the value of the contract. Do I have a motion? Okay, it's been moved and properly seconded. So this particular item does have a proposed amendment sponsored by myself. I am not planning on introducing the amendment this evening, but I did want to include it in the packet so people could start to read some of the direction that the administration is interested in taking the Fusus conversation. So it is in there, so I encourage you to ask questions. If you have any questions about the amendment that you'd like to ask the administration tonight, we can do that tonight. We do have potentially it's not potentially, last night it was announced in Budget and Finance, we'll have a joint committee meeting specifically about the Fusus agreement and this amendment on February the 5th. And so that will be something that will be forthcoming. And so based on the budget conversation yesterday, it was deferred by rule. However, we can still have, if there's people that have questions that they want to put out into the universe in here today, you're welcome. I can recognize you. You can ask your questions just so they're on the record. But I'll also be looking for a motion to defer. I see nobody. Oh. All right, we got a motion to defer, and we've got a second. All those in favor of the motion to defer? All right, anybody opposed? All right, and it's deferred to one meeting, which I didn't say. So is that just assumed, Director? Okay, thank you very much. So it is deferred to February 6th. Okay, everything else, with the exception of the late resolution, everything else I have on a consent agenda. And I'll go ahead and read these items, and if there's anything that you want to pull off for any questions, we can do that. So item number 2, which is RS 2024-160, Porterfield, Evans, and Welsh, appropriates a total of $25,000 from the juvenile court to the Center for Health Policy, Meharry Medical College, a nonprofit organization selected to receive Community Partnership Fund grants. Item number 3, RS 2024-162 by Porterfield, Evans, and Welsh, accepts a grant from the Tennessee Office of Criminal Justice Programs to the Metropolitan Government, acting by and through the Office of the District Attorney General, to provide partial funding for 4 specialized victim witness coordinators to work with Spanish-speaking victims and within the Crimes Against Children unit. Item number 4, RS 2024-168, Toombs, Porterfield, Evans, and Swara, authorizes the Metropolitan Public Property Director to sign and record a notice of federal interest pursuant to a community project funding grant from the U.S. Department of Health and Human Services to the Metropolitan Government, acting by and through the Department of General Services, funding the construction of the future Nashville Assessment Center to provide therapeutic pre-charge diversion services to address low-level misdemeanor and youth offenses to be located on the first floor of the JJC building on the NYCE. Item number 5, RS 2024-169 by Porterfield, Evans, Welsh, and Swara, approves Amendment 1 to a grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide oral disease prevention services for school children in grades K to 8 in qualifying public schools. Item number 6, RS 2024-170, Porterfield, Evans, Welsh, and Swara, approves Amendment 2 to a Community Health Workers for Public Health Response and Resilient Grant from the Centers for Disease Control and Prevention to the Metropolitan Government, acting by and through the Metropolitan Board of Health to address COVID-19 health disparities in the Nashville area. Item number 7, RS 2024-171, Porterfield, Evans, Welsh, and others, approves an application for a Homeless Management Information System grant from the U.S. Department of Housing and Urban Development to the Metropolitan Government, acting by and through the Office of Homeless Services to pay for the software system vendor, purchase additional user licenses when needed, and continue integrating data from the Nashville Rescue Mission. Item number 8, RS 2024-178, Porterfield, Evans, and Welsh, approves Amendment 1 to the grants contracts between the Metropolitan Government acting by and through the Office of Family Safety to various nonprofit organizations. RS 2024-179 by Porterfield and Evans approves the Homeland Security grant application from the State of Tennessee, Tennessee Emergency Management Agency to the Metropolitan Government acting by and through the Office of Emergency Management to fund efforts to prevent, prepare for, protect against, and respond to acts of terrorism. Any of those items need to come off. Mr. Benton, you had one. Item number 6. All right, so we'll pull item number 6 off of the consent agenda. Any other items need to come off? Okay. Do I have a motion on the remaining items? All right, it's been moved and properly seconded. All those in favor of the remaining items? Anyone opposed? All right. We move approval. 8 in favor, 0 against. 9, I'm at 9 now. All right. Very good. Let's go to item number 6. Do Ms. Leach or Mr. Sharp, do you want to come up and speak about the community health workers?
Thank you, Madam Chairman. That's a 3-year grant. This is the 3rd year. That just adds $1 million a year as they have been. There are 6 of those. 1 of them is at the health department. 3 are at Matthew Walker, and 2 are at Shalom, I believe it is.
Okay. Councilmember Benton, did you have questions?
I was just trying to understand, since the public health emergency officially ended in May of 2023, why are we still in need of the government assistance? Or, is this some kind of carryover and it does something a little more in depth that I'm not aware of? Yeah,
that's a good question. So a lot of the COVID money was really pretty heavily restricted, and some of it we couldn't use it because we could no longer do those things. There wasn't the demand for whatever it was. A lot of them were a little more flexible about that. The community health workers is a concept that's not limited by any means to COVID. It's something that's to help people navigate the system and know where to go and who to talk to and what kind of help is available to them for whatever it is that they need. And they allowed us to use that money for this purpose.
All right. Any additional questions, Councilmember Benton? It looks like Councilmember Huffman now has a question.
Hey there, just a really quick question in regards to these services. In regards to the vaccines that are being given, is this a vaccine, for example, for COVID-19 that's just singularly purposed, or is this one of the dual vaccines, kind of like I got a couple weeks ago?
I don't know. That's a good question. I can find out, though.
Yeah, okay. That'd be great. Thank you.
Yeah.
Any other questions for Mr. Sharp? All right, do I have a motion?
Second.
Okay, it's been moved and seconded. All those in favor?
Aye.
Anyone opposed? All right. We move approval. 9 in favor, 0 against. Since we're coming up on our late filed resolution, one of the things that I didn't do at the beginning of the meeting is model the new committee member signs. So if you're watching this at home, we have these yellow and black signs that we will be, Sherry Weiner, Councilmember Weiner, zoom in on her, please, as the sign that she's displaying. So you'll be seeing us kind of getting used to like making sure we have our signs up whenever we are on a committee that is meeting in here. So that way everybody can recognize like who is actually voting that's on the committee, who has a question that's on the committee, that kind of thing. So we'll get used to using those. Yesterday was our debut. All right, let's go to our late resolution. This is a resolution authorizing the Metro Human Relations Commission, or MHRC, to engage Melody Fowler Green as appropriate counsel on an hourly fee basis to represent the MHRC in connection with the title, is that 6, complaint against, thank you, complaint against the Metro Arts Commission. All right, we have a motion. It's been seconded. Okay, any discussion on this one? Looks like Councilmember Nash, you were recognized.
Is there a particular reason we're going to outside counsel and this is not being handled by Metro Legal?
Yeah, let me recognize the, thank you, admin table. Oh, there we go. There we go.
Hi, Councilman. I'm Laura Fox from Metro Legal. The reason this is going to outside counsel is because there's a provision in the code that says when a complaint is actually filed against Metro itself, the director is allowed to give permission to the HRC to get outside counsel, and the director of law agreed that this was an appropriate case to do that.
Thank you, Councilmember Nash. Any other questions on this one? Okay. Since there's no other discussion, all those in favor? Anyone opposed? All right, we move approval. Okay, I don't have any other announcements. We did have to defer our, oh, I'm sorry, Councilmember Weiner, let me recognize you.
Thank you so much, Chair. I thought it would be important to let everybody know that that meeting on the 31st that we alluded to for the pet working group is actually going to be at 6 o'clock. So don't come at 3 o'clock, don't come at 2 o'clock. Make sure you're here at 6 o'clock. Thank you.
Thank you, Councilmember Weiner, for that clarification. I was going to say that we had a speaker plan for this meeting, but because of the movement to this week, essentially because of our shortened work schedule with the holiday, I had to postpone our speaker, and we'll hear from Jill Fitchard at our February 6th meeting. And then if there are other departments that you're interested in hearing from, my intention is to invite somebody to come every single meeting if possible, so that because this committee has so many different departments that we're hearing from with legislation, and also just departments that may not have legislation, who may just have, business working, with the council that we should hear from. So if you have recommendations or suggestions about people you'd like to hear from, please let me know, or actually let Director Darby or Hannah Zeitlin know, and they'll tell me, and I'll be sure to invite people. Since there's nothing else for the good of the committee, then we will consider this meeting adjourned. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.